It's estimated that these plans will go down 11%. If the enhanced tax credit goes into place, it goes up down 5%. We're estimating they're going to go down 11%.
Let me just read to you some stories from some folks in my district. Let me quote. I just received my letter, and my monthly costs have gone from $1,287 to $3,026 for next year. You also slipped in here a poison pill that is yet another attempt to ban abortion nationwide, and let me explain how. This bill makes it harder, if not impossible, for women with ACA plans to get an abortion, even in states where it is legal. This is a backdoor ban on abortion for millions of women in this country, plain and simple.
It doesn't count this year. And like, if you paid for your lunch yesterday and the day before, you don't have to pay for it today and tomorrow. It's pretty ridiculous.
We're wasting our time giving Republicans a show vote, a cover-your-ass vote, so they can pretend like they're doing something on health care before they skip town for the holidays. You also slipped in here a poison pill that is yet another attempt to ban abortion nationwide, and let me explain how. This bill makes it harder, if not impossible, for women with ACA plans to get an abortion, even in states where it is legal. And by tying cost-share reduction subsidies to a ban on abortion, this bill goes beyond the Hyde Amendment, beyond the Dobbs Supreme Court case, and will leave millions of women without access to affordable insurance that covers abortion. This is a backdoor ban on abortion for millions of women in this country, plain and simple. And in states like Massachusetts, where ACA plans are required to cover abortion care, this bill penalizes all my constituents by increasing out-of-pocket costs for all health care services, not just abortion care. But again, this bill is not going to become law. We're wasting our time giving Republicans a show vote, a cover-your-ass vote, so they can pretend like they're doing something on health care before they skip town for the holidays. I mean, there's lots of things to be outraged about every day in this town, but this is truly outrageous. And it makes me sick. Mr. Guthrie, since 2020, when Democrats enacted the enhanced premium tax credits, enrollment in the ACA has more than doubled, from 11 to more than 24 million Americans. Do you know which states have seen the highest growth in people choosing ACA coverage?
I know that even with the shutdown and everything that's gone forward, there are more people enrolling in the ACA today than there was this time last year. I don't have a specific state.
Well, I'll tell you, the states are Texas, Mississippi, West Virginia, Louisiana, Georgia, and Tennessee. In fact, 88% of the growth in coverage have been in states that President Trump won in 2024. Now, allowing these policies to expire are going to hurt your own constituents the most. And what are you going to say to the 14,000 working people in Kentucky and their families who are going to see premium increases in just a few weeks? What will you say to the 60-year-old couple earning roughly $85,000 who will see premiums go up by more than $20,000 next year?
We're putting forth the cost-sharing reductions that we had in this summer and the working family tax cuts, and it's estimated that these plans will go down 11%. If the enhanced tax credit goes into place, it goes up down 5%. We're estimating they're going to go down 11%.
Let me just read to you some stories from some folks in my district. Let me quote. I just received my letter, and my monthly costs have gone from $1,287 to $3,026 for next year. As a working family with a daughter who has an autoimmune disease, we're struggling. I'm working 50-plus hours a week just to pay the insurance. Another one. If I continue on the same plan I am on now, it will be 2.5 times more and be unaffordable. $1,500 plus a month is incredulous for a person's health premium. When I calculate my net income, not gross, it is beyond sustainable. Another person. With the Health Connector, I was paying $264 per month. Acceptable, seeing I am healthy but not young. Without the advanced premium tax credit, my monthly premium will be just over $800 per month. I can and I won't pay that. I will go without. These are real stories from real people that I represent. I don't know how anybody could sit here and claim that somehow this bill is going to lower premiums. It's absurd. I mean, the crisis is now. The crisis is now. And this is another thing I find inexcusable. I mean, Republicans are saying that it is, quote, too expensive to extend the health care tax credits for working people. But yet they had no problem with giving $4.5 trillion in tax cuts in the big ugly bill, giving millionaires an extra $80,000 per month. Mr. Thompson, wasn't it true that Republicans used fantasy math called the current policy baseline to say that anytime you extend a tax cut, the cost of the taxpayer should be actually zero?
Yeah, they used particularly fuzzy math, and they said because we spent money last year, it doesn't count this year. And like, if you paid for your lunch yesterday and the day before, you don't have to pay for it today and tomorrow. It's pretty ridiculous. And the other thing, Mr. McGovern, that I think needs to be pointed out, Chairman Smith was talking about people who didn't use their insurance, and somehow that was fraudulent behavior. That's just not accurate. If that's not how insurance works, and we all know that. There's people, I'm sure, in this room today who haven't used their insurance. I pay for my auto insurance, and I didn't wreck my car and haven't had to use it. So it's not fraud. And Madam Chair, to suggest that Democrats only want to throw money at problems, I would submit to you that anybody who says you can't fix a problem by throwing money at it's talking about somebody else's problem.
Congressman Ryan McKenzie and a number of other battleground Republicans have been pushing to have tax credit extensions on the ACA. I was curious what your thoughts were on their efforts. Is that something that the administration is behind?
So first of all, just on healthcare costs, if you look at some of the worst healthcare costs for American citizens, the biggest drivers of increased healthcare costs, it is the cost of prescription drugs. It simply got way too high, and it got too high because we allowed other countries to take advantage of it. I'm talking about the same exact drug that would cost $300 in Great Britain or $250 in France would cost an American $5,000 or $10,000. We were subsidizing the entire world's prescription drugs, and no president had the courage to put a stop to it. And Ryan McKenzie has been very supportive on this. Nobody had the courage to put a stop to it until Donald J. Trump said no. We are done getting fleeced on pharmaceuticals. Europe has to pay up so that our great American citizens can pay less. That's the most important thing that we've done. Now, you are right that the health insurance market, the health insurance system is totally broken. It's been broken for 15 years, and we're working with Congress, both Democrats and Republicans, to come up with a solution. You talked about premium support. We think that everything should be on the table, but Democrats and Republicans, they got to work together and put something on the president's desk to sign. Now, I will tell you, we've been involved in probably 10 different health care bills. We've been talking to Ryan about it. We've been talking to my friend Bernie Moreno from the state of Ohio. We've been talking to Susan Collins about it. We've even been talking to a few of the reasonable Democrats who are putting ideas out there. But Congress has got to get us something to lower the cost of health insurance for American citizens. The Obamacare system was broken. Donald J. Trump wants to fix it, but Congress has got to step up here.
Well, Mike Lawler is a very dear friend and a close colleague of mine. And ironically, weekend before last, I was in New York in his district on Long Island, and we were campaigning together, ensuring that he gets reelected. Mike Lawler fights hard for New York, as every Republican in this conference does for their districts. The districts are different. They have different priorities and ideas, but we do have, there's about a dozen members in the conference that are in these swing districts who are fighting hard to make sure that they reduce costs for all of their constituents. And many of them did want to vote on this Obamacare, COVID-era subsidy the Democrats created. We looked for a way to try to allow for that pressure release valve, and it just was not to be. We worked on it all the way through the weekend, in fact, and in the end, there was not an agreement wasn't made. Now, everybody was at the table in good faith, and I certainly appreciate the views and the opinions of every member of this conference. But I will tell you one thing they will all join in unity on is voting for this bill that we've been discussing this morning, because, again, instead of just trying to assist 7% of Americans, this is for 100% of Americans, and we can handle that and do that together. I hope that Democrats will come along with us. If they're serious about solving the problem and bringing down cost of health care, they'll all fully support it as well. But I think you're going to see they're playing politics with this.